We're good. Yes, hi everyone. This is Dr. Khan again, Bloomfield Hills, Michigan's executive plastic surgery. So I've just completed an N block 72524 initials JAD. This is the out of town patient. So she comes to me with grade 4 contracture on the right side. And basically a lot of pain on the right side. She had workup with an MRI that showed what was a rupture. And as you will see, I'm going to go ahead and open this second. You can see, look at the contour of this. This is outpouring here, here, and then there's some inflamed tissue here. I'm going to open the left side up first. So as you can see, look how super ultra thin this capsule is. If I go ahead and hold it, you can see actually the back side of the implant. You can see how thin this is. No matter how thin, the whole capsule has to go. And this was done en bloc. Inflamed tissue, I did not like how these feel, so I removed this along. With this, these are implants from 2001, silicone implants. She had a lot of pain on the right side. She had a very prominent scar, as you can see. She actually had the lollipop anchor lift, so I revised the scar, kind of gave her a lift today. So this patient actually got a lift, and I cut out the excess skin. The nipple areola was irregular as well. There was a lot of scar tissue. And as you can see, look how thin that capsule is. No matter how thin, the entire capsule must be removed. So done end block. I'm very happy with the minimum blood loss. It was probably like 3 cc's. So as I go in, this is the ultra thin capsule. You can see how it is, how thin this capsule is. You can see that it doesn't take much below the muscle. So it was very tedious dissection right up off of the rib. I remember that's the gold standard. Now, as I go in, you will see this implant from 2001. So this is 23-year-old set of implants. What's interesting is, this is your 275, and there is some fluid around. So if I go like this is your gel bleed, that leaching of the silicone that is the culprit behind what is the breast implant illness. So this is 275. Remember, back in the day, 2001, you could not get silicone implants because they were banned. You could get them under experimental conditions if you were part of a study. So 275. And you can see, look over here, how thin this capsular tissue is. If I put this right on top of the ruler, you can see how thin this is. You can actually read up the print. So no matter how thin the capsule, you have to remove it because that's the culprit behind what is the breast implant illness. Because those patients where the capsule was left behind, the patients continue to hurt. Now what I'm going to do is I'm going to remove my top glove and I'm going to focus on the right side. This is the grade 4 contracture. Now if I hold this up, you can see how thin, again, how thin this capsular tissue is. And look at this bulge. Look at this bulge. It goes like this, and then another bulge. And if I put this down, you can see this is how you have to be able to dissect without cutting into this super ultra thin capsule. So what I'm going to do is, this was done en bloc, the gold standard. All of it was contained. We know from the MRI, we know from the shape that this is indeed very much ruptured from 23 years ago. You can see how thin the capsule is. So as soon as I go in, you can see all of that silicone is essentially preserved, and none of this spilled into the chest. This whole surgery is about precision, so none of this silicone spills into the chest. You can see the very prominent scar right here. I'm going to put this tissue here. So as I go in, I just want you to see that this was all contained, none of it ruptured into the chest. And you can see it's very much consistent with slime. Very, very thin capsule, as you can see right here. Look at this, how thin this is. You can see my blue glove. And again, if I may use this ruler, you can see, you can read actually the markings. This is how thin, ultra thin the capsule is. And this is where the care precision is done, such that none of this spills into the chest. And overall, I'm very happy. And you can see the gel bleed is certainly a whole lot more at a different level because it's ruptured. And look how that shell of that silicone implant is basically can be separated from the internal slime, if you will. So the gold standard end block, everything contained, no need for drains. She's actually getting a lift. And because she already had the lollipop anchor incision, she had a grade 4 contracture on the right, and I felt comfortable doing this for her. She's going to be aesthetically very pleased compared to where she was before and after. I revised the whole nipple areola all the way down to the crease so that she's going to be symmetric. The entire surgery was done end block, as you see, which is the gold standard. None of this bullet in the chest. Between last week and this week, I've removed 10 ruptured implants, which is, again, goes to showing you that they're not meant to be in the body forever. They have a certain lifespan, i.e., within the body. They do disintegrate, some sooner, some later. We saw the 2016 silicone implants from last week, early last week, where both of them were ruptured. And so we did the Facebook Live yesterday where both of them were ruptured from 2010. So again, goes to showing you that they need periodic monitoring. And if those patients who are hurting, from my experience, and which is the goal here is to remove the entire implant capsule, all inflamed tissue with that capsule and that inflamed tissue around such that none of that silica is left behind and the patient has the best chance to bounce back. So the implants will be actually returned to the patient. Number two, cultures done for aerobic, anaerobic, and fungal. Number three, no need for drains. Number four, twilight sedation. Number five, the patient will get pictures, videos of her chest showing complete removal of the whole capsule. All patients get the same surgery, and post-operatively, we will see how the patient bounces back. She will have the peace of mind that her surgery was done in a very defined, controlled way, in a very safe way. Blood loss was less than 3 cc's on each side. Well over 99.5% of the time, the blood loss is less than 5 cc's, and well over 99.5% of my patients. I'm very happy and content with how the whole case has gone. And there you have it. This is Dr. Khan, Executive Plastic Surgery. I will go ahead and post that Facebook because it gives you a. I can hold it. If you ever see this one, deletion settings, you go here, never delete. So post it now. So, and again, this is tricky, learned by trial and error. Thank you.
Mm-hmm.
So this one I'm gonna end right now.